Hey guys, are you people aware that heart attack has eaten so deep into our society today, killing both the young and the old? Are you also aware of the various warning signs that are serious indications of heart attack? Do you know the various causes of heart attack, its different forms of manifestation, and how it can actually be prevented? Right in this video, I will teach you all you need to know about heart attack, its various forms of manifestation, the causes, and how it can be prevented from occurring. Mind you, prevention is better and cheaper to cure. And all you need to do is just to pay attention. Follow my video, watch my video to the end, and I will unveil to you the secret behind heart attack, how it can be prevented, how those warning signs actually occur, how we can actually manage heart attack. If you are watching my video for the first time, please don't forget to press the subscription button. Subscription is free. Like, share, and comment on my video. And if you are a returning subscriber, God bless you. I'm still there, your brother and your friend, Stephen Oluwatumininu. Now, let's talk about heart attack. But before we start discussing the various warning signs of heart attack and how it can actually be prevented, we are expected to learn the basic knowledge about heart attack, how it actually occurs. This will help us to really understand the concept of heart attack. It will help us when we begin to notice all these warning signs and how we can actually prevent it from occurring. What is heart attack? Another name for heart attack is called myocardial infarction. Myocardial infarction are medical emergencies because nowadays, especially in Africa, we do attribute most of the premature death to, spiritual cause. Heart attack are medical emergencies. Heart attack or premature death are not all being caused by spirits or are not attributed to spiritual cause. So let's know this. Heart attack occur as a result of deprivation in blood supply, oxygen supply, and nutrient supply to the heart muscles. When the heart muscles is being deprived of blood supply, which contain the oxygen and the nutrient supply to the heart muscles, this leads to the death of the heart muscles that we call ischemia or necrosis. And when any tissue dies, it will surely be replaced with scar formation. When there is a scar formation around the heart muscles, it will impair or interferes with its pumping ability. Heart is known to pump blood to the various body parts for their daily metabolism. So when there's a scar tissue formation, it impairs its pumping ability. And also remember that deprivation of oxygen and nutrient supply to the heart muscles leads to the death of heart muscles. And if it is not properly managed, or if the oxygen deprivation is not quickly restored, definitely you should know that the heart will eventually fail, leading to heart failure. Now let's talk about the various causes of heart attack. Now that we've understand what heart attack is, what are the various causes? Number one, heart attack can be caused by hypertension. Hypertension is increase in blood pressure. Whenever there's increase in blood pressure, this damage the wall or of the blood vessels or the wall of the arteries, supplying blood to the heart muscles. And when there's a damage to the wall of these blood vessels, it also leads to the narrowing of the inner lining of the blood vessels, thereby reducing the blood flow to the heart muscles. And even at times, this blood vessel even eventually ruptured, resulting into clot formation that will totally obstruct the blood flow to the heart muscles, leading to the death of the heart muscles. Another cause is diabetes mellitus. Diabetes is increase in the blood, in the sugar content of the blood. And as a result of diabetes, it also affects the blood vessels that is conveying blood to the heart muscles. It damages the inner lining of these blood vessels, affecting its functions by conveying blood to the heart muscles. It also leads to a kind of a plaque formation within the inner lining of the blood vessels that is supplying blood to the heart muscles. And when this plaque begins to build up, it totally obstructs blood flow with the content of the oxygen and nutrient supply to the heart muscles. Another one is increase in cholesterol level. Increase in cholesterol level, just like I said, leads to the deposition of fat, plaque, and cholesterol within the wall of the blood vessels, which cause a kind of narrowing of the blood vessels, reducing blood flow to the heart muscles and causing a total blockage of blood, the oxygen and nutrient supply to the heart muscles. Another one is obesity. If you are overweight, definitely you should know that you are not far from having hypertension, you are not far from having diabetes, even increase in cholesterol level. Another cause is disruption in mental health or stress or mental health disorder. When you are being subjected or consistently being subjected into stressful conditions, or when your mental health is being impaired, it usually leads to the release of stress hormone, which is called cortisol, that triggers your blood pressure, leading to increased blood pressure and thereby leading to development of heart attack. We have chronic kidney disease. Anything that affects the kidney surely will affect the heart. It will affect the blood vessels and affect the blood pressure, and anything that impairs with the blood pressure, leading to increased blood pressure, will lead to heart attack. Honestly, we have many more of the causes. We have sleep pattern disturbance that result into heart attack, and we have many other causes, but time won't permit us to mention all this. But these are the various common causes of heart attack within our environment. What are these warning signs that we're talking about? What are the warning signs that when we begin to notice, we will definitely know that yes, heart attack is right on its way to cause havoc? Number one warning sign is chest pain. The chest pain can be described as heaviness in the heart, tightness in the heart, or squeezing pain that occur right at the middle of the chest, even at the left side of the chest, and even some radiate down to the stomach. When we begin to have such a pain like this, we should know that this is a warning sign of heart attack. And why does this pain occur? Like we said, heart attack occurs as a result of deprivation in blood, oxygen, and nutrient supply to the heart muscles. When this occurs, then the heart muscles will be necrosed or become ischemic, meaning they will die. And as a result of this, now there will now be shifts in aerobic metabolism to anaerobic metabolism, leading to formation of lactic acid, which is a byproduct that irritates the nerve endings and leads to sensation of serious pain, which may be on and off. It may come and it may go. This pain may also radiate from the middle of the chest or the left side of the chest, even to the neck, to the upper arm, even to the back, and at times even to the stomach, to the jaw. All these are serious warning signs of heart attack. Although there are some chest pain that do occur to the smokers, then never mind, even if you are a smoker, you should know that you are not far from having hypertension and also heart attack. So please, let's learn to distinguish this. When we have a kind of the chest pain that I've just described, honestly, this is a serious warning sign of heart attack. Another warning sign is shortness of breath, dyspnea. This shortness of breath occurs when there's a deprivation in blood supply, oxygen supply, and nutrient supply of blood to the heart muscles. Now the heart muscles will begin to die, leading to necrosis and ischemia. Now weaken the heart muscles in an attempt to pump sufficient blood with the oxygen content to the various body parts for their daily metabolism. Insufficient supply of blood with the oxygen content and as well the nutrient to the body cells leads to shortness of breath. Let's take note of this. And this shortness of breath can occur even when you are at rest, not necessarily with exertion or when you are being involved in a vigorous exercise. No, even at rest, you can begin to experience shortness of breath. Another one that we shall be talking about is lightheadedness or dizziness. Normally it's just like when it's compared to you as a human. When you haven't eaten, when you haven't taken water, and you are being subjected to work, definitely to get to a stage you begin to have dizziness. That is exactly how it is. When there's a deprivation of blood supply with the content of the oxygen and nutrient supply to the heart muscles, definitely you should know that there will be a kind of, dizziness and, lightheadedness. It do occur. I do compare heart attack to when an individual, when your nostrils are being blocked, you are not allowed to inhale oxygen, you are not allowed to eat or take water. For example, if you are being locked in a room, what will actually occur, gradually you become weak, and if your nostril is not being released immediately for you to inhale the necessary oxygen, you end up dying. That is exactly how heart attack occur. So let's take note. Another warning sign, apart from the lightheadedness or the dizziness we're talking about, is cold sweating. When you just notice that you begin to profusely sweat without having increase in temperature and without being exerted, that is, you are not involved in an exertion of vigorous activities, definitely you should know that heart attack is right on its way. We have many other warning signs. Palpitation is there, and fatigue, that is unnecessary tiredness and raising of the heart. You begin to feel like a raising in your heart and you feel tired. It's just like when you have not taken food, when you don't have sufficient oxygen, to breathe in. Just like the heart muscles have been deprived of the blood, the oxygen content and the nutrient content, they will become weak. And that is how fatigue usually occur, palpitation as well actually occur. Please, let's take note, when we begin to experience any of these warning signs, it is high time for us to visit the nearby hospital. Now, how can we prevent this heart attack from actually occurring? It is as simple as this. If you are having hypertension, you need to take care of your blood pressure regularly. Regularly observe your blood pressure, take your drug as prescribed, follow the prescription regimen, and go for follow-up visit. It is very, very important. Also, diabetes, you need to control your blood sugar. Make sure it is within the normal limit. Take your drug as prescribed, involve in little exercise that is being prescribed for you, and always regularly check your blood sugar. Check your blood pressure as well, because most of diabetic patients are also prone to having hypertension. If you are obese or overweight, this is high time for you to pay attention to your weight. Involve yourself in active exercise. Active exercise at least 30 minutes per day, every 5 days per week. At least 30 minutes, that is at least. Active exercise, not a vigorous one. Active one, slow and steady exercise for you to burn your necessary weight, burn your fat, and make sure your weight is between the normal limit. It is very, very important. Also, if you are experiencing increase or high in cholesterol level, it is high time for you to pay an attention to your health. You can go to my YouTube channel, Stephen Oluwatumininu. I've talked much about cholesterol, high cholesterol level and its management. You can also have some tip there, because time won't permit us here for me to talk much about how you can, solve the problem of high cholesterol level, solve the problem of being overweight or obesity. You can talk much about this. But if you are experiencing any of this, if you are being overweight, suffering from obesity or high cholesterol level, please pay attention to your health. Visit a nearby hospital. Take your drugs as prescribed and involve yourself in, active exercise. Also, your diet also matters. If you check my subsequent videos in my channel, you will know much about all this that I'm talking about. Another thing is stress and mental health disorder. You need to avoid unnecessary stress, and you need to pay attention or manage your mental health. It is very, very important. I've done a video on how to improve your mental health. It's right there on my channel. You can go there to get more information about how your mental health can be managed, how you can improve your mental health. As well, stress, how to manage stress. I've talked about that. You need to manage stress. remove any stress triggers that will prone you to increase blood pressure and having heart attack. Also, if you are suffering from chronic kidney disease, it's high time for you to pay an attention to your systemic disease, because anything that affects the kidney will definitely affect your blood pressure and cause a kind of heart attack. Anything that affects your liver will down to the kidney, from the kidney down to the heart, and resulting into premature death. Just like I've said, heart attack has eaten so deep into our society, causing series of premature death, preventing so many dreams and aspirations from being fulfilled. Please, let's learn to pay attention to our health, prevent occurrence of heart attack instead of attributing the various causes of premature death to spiritual cause. This has been very, very common within our community. We need to stay away from this. If you continue to attribute the cause of medical emergencies to spiritual cause, you will never come to a conclusion or come to arriving at the solution to your problem. You will just end up walking at a cross purpose, looking for solution where there is no solution. So heart attack are medical emergencies that need to be taken care of, that need to be prevented from occurring, so that all our dreams and aspirations in life can be fulfilled. Don't forget to subscribe to my channel, like, share and comment on my video. And if you have any question, don't forget to put it at the comment section, and as quickly as possible I will respond to your comment, I will respond to your question and give you more enlightenment. Thanks and God bless you.